My name is Momodou Nyassi. I'm currently the Deputy Director of Health Services, but I benefited a scholarship from a Merck Foundation in collaboration with the Office of the First Lady of the Republic of the Gambia in November 2018 to February 2019. It was an advanced course for clinicians on assisted reproductive techniques to deal with cases of infertility in our country. So the courses took place in International Institute of Research and Reproductive Health in Bangalore, India. It was a 3-month course, and the course really impacted a great deal. Before I went to attend the course, I had very basic knowledge on reproductive and infertility especially. And this is a major challenge that has been affecting most of women of reproductive age in our country, because infertility in our country is a very serious and sensitive issue today. It has led to so many divorces because of issues related to infertility. And because the awareness also in our country was lacking. So upon completion of these courses, obviously we had conducted so many sensitization program about issues related to infertility and how it can be handled amicably in our country. So in my practice, I have gained a lot of knowledge, because from the clinical part of it, you have to investigate what is the real causes of infertility. As I said before, I went to do this course, I have very basic knowledge when it comes to infertility. So the training has really equipped me when it comes to it. Has already expanded my horizon, my thinking, my knowledge when it comes to infertility, from the investigation part of it, the clinical part, the history, how you should take the history, how you should condone people, how are you going to fight the stigma connected to infertility. All those things has been giving me a lot of knowledge in terms of how to handle all those things, especially the diagnostic, how are you going to diagnose infertility and how you are going to treat it is very critical. If you don't know how to diagnose it and how to treat it, the problem will not be solved. The social part of it also was taught how we should handle it in our country. So it has really impacted positively in my practice, and it has given me a wider horizon of how we should handle it in the country. And some of the success stories are many, but I can choose few, because there was a couple. Yes, they have been married for more than 10 years with so many social problems within the marriage. And the family of the husband calls the wife so many names. He is feeding somebody for nothing. You know the concept in our society that you marry somebody and the person is not bearing kids to you. How disturbing, not to the man, but to the woman. So it affects them greatly, psychologically, even society. Their fellow women will call them names. So with so many investigations conducted among the two of them, then we realized, okay, the man has the sperm counts are very low. It's not actually the woman that has this problem. So we counseled the man, okay, the problem is not really the woman, it's you. So we told the man what he should be doing after giving so many treatments, and we give them the best time to have sexual relationship, despite the fact the sperm count are very low, but there are also chances of getting pregnant. We tried it. After 1 or 2, 3 months, the woman conceived. This is the kind of pregnancy that we don't want her to miss. So she was given 100% concentration, regular clinics, regular antenatal visit. And we don't want her also to miss this pregnancy due to normal delivery. So the best thing we conducted was to do a quick cesarean section so that the child will not suffer that process of normal delivery through the birth canal. So we have to do a cesarean section, and that became a boy. So it was a joyful and happy moment for both family. And these are something that we've been advocating for, though there are some challenges when it comes to laboratory investigation in our setting. But Merck Foundation, they are training a lot of people in different areas. Some are doing andrology, some are doing infertility, some are doing diabetics, some are doing oncology. So these are things that we thank Merck Foundation for what they've been doing through the office of our First Lady, Madam Fatmata Barbaro, for her positive contribution towards the side of health. So we thank the office of the First Lady, and we hope and pray for her success in the near future. Thank you very much.